Daily Vitamin Plus Iron is a multivitamin and iron product that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for the body and help maintain good health. It is important to take the recommended daily dosage at the best time to ensure maximum benefits. Be sure to consult with your healthcare provider for the proper dosage and timing for you. When taking Daily Vitamin Plus Iron, it's best to take it by mouth, usually once a day or as directed by your doctor. Make sure to follow all the instructions on the product package, and do not take more than the recommended dosage. If you have any questions, don't hesitate to ask your doctor or pharmacist. For optimal effectiveness, take this medication on an empty stomach, either 1 hour before or 2 hours after meals. It's important to take it with a full glass of water, unless your doctor tells you otherwise. If you experience stomach upset, you can take this medication with food. However, avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. After taking the tablets or capsules, make sure not to lie down for at least 10 minutes. If you're unsure about your specific brand, consult your doctor or pharmacist for more details. If you're taking the delayed-release form or extended-release capsules, make sure to swallow them whole. Do not crush or chew them, as that can lead to increased risk of side effects and decreased absorption. Only split extended-release tablets if they have a score line and your doctor or pharmacist advises you to do so. Remember to take this medication regularly at the same time each day to get the most benefit from it. Side effects of Daily Vitamin Plus Iron may include constipation, diarrhea, or upset stomach, but these are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, contact your doctor or pharmacist. Iron may cause your stools to turn black, which is not harmful. If your doctor has prescribed this medication, it means that the benefits outweigh the risks of side effects for you. Many people using this medication do not experience serious side effects. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. Remember, in the US, you can call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can call your doctor for medical advice or report side effects to Health Canada. It's important to keep Daily Vitamin Plus Iron supplements out of reach of children, as accidental overdose of iron-containing products can be fatal for children younger than 6 years. If an overdose does occur, it's important to seek medical help immediately or call a poison control center. As for the recommended dosage, it's best to follow the instructions on the label or as directed by your healthcare professional. It's also important to take the supplement at the optimal time, which is usually with a meal, to help with absorption. Before taking Daily Vitamin Plus Iron, it's important to talk to your doctor or pharmacist if you have any allergies to its ingredients, or if you have a history of iron overload disorder, alcohol use, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, it's important to let your doctor or pharmacist know if you have a vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia, which can result in serious nerve problems. Before having surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication. When taking daily vitamins with iron, it's important to be aware of any potential interactions with other medications. This includes drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. To ensure proper absorption, it's recommended to separate the doses of these medications from the daily vitamin with iron. If your multivitamin also contains folic acid, be sure to inform your doctor if you take certain anti-seizure drugs. Additionally, be aware that this medication may interfere with certain lab tests, so it's important to inform lab personnel and your doctors that you are taking it. If you or someone else has taken too much of this vitamin and iron supplement and is experiencing severe symptoms like fainting or difficulty breathing, you should seek immediate medical attention. In the US, you can call the Poison Control Center at 1-800-222-1222. In Canada, you can call your provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has recommended this daily vitamin with iron, it's important to follow their instructions and not share it with others. It's essential to attend all medical and lab appointments while taking this medication. Some brands may also include additional ingredients, so it's a good idea to ask your doctor or pharmacist if you have any questions about the specific ingredients in your brand. It's important to note that this product is not a replacement for a healthy diet. It's best to get your vitamins and minerals from nutritious foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines provided by your doctor. As for the daily dosage, it's important to follow the instructions provided by your doctor or on the product label. And when is the best time to take this? It's typically recommended to take it with a meal to help with absorption, but be sure to follow the specific guidelines given to you. If you forget to take your daily vitamin with iron, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one. Don't take double the amount to make up for it. It's best to take this vitamin at the same time every day to keep your iron levels steady. It's important to store your daily vitamin plus iron at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless specifically instructed. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.